Hello everyone, how are you doing? Welcome back to case 2 of the clinical psychiatry cases. Today we have an interesting case called A Postpartum Change, written by Dr. Ian Jones, and we always get our cases from the DSM-5 Clinical Cases book, edited by John W. Barnhill. Alright, let's get started. So Ursula Norman, a 32-year-old nurse, was brought to the emergency department 6 days after giving birth. Her husband clearly indicated that she had been behaving very strangely and that she had become convinced that she had smothered and killed her baby. Her husband reported that after a normal pregnancy and uncomplicated delivery, Miss Norman had happily gone home with their first child. On the 3rd day after delivery, however, her mood and affect began to shift rapidly, between elation and weepiness. She became irritable and anxious. She had slept only an hour a night, and even when her baby was asleep. Her behavior became increasingly bizarre, with overactivity and agitation. Her speech was rapid and aggressive. Although not previously a religious person, she became convinced that God was speaking through her, and that she had special powers that could solve the problems of the world. She told her husband that she could identify evil people by looking into their eyes, and had begun to worry that she was surrounded by evil people, including her own mother. Most disturbing for her, whenever she was out of sight of her son, she became totally convinced that she had smothered him, and no one could convince her otherwise. Miss Norman had a history of 3 episodes of major depression in her teens and early 20s. These episodes resolved with psychotherapy and antidepressant medication. She also had a psychiatric admission for mania 3 years prior to the delivery of her child, after a flight from Asia to Europe. Following treatment with antipsychotic medication, she became depressed for several months. Although a diagnosis of bipolar disorder was discussed at that time, she was reluctant to accept this label, attributing the episode to stress and jet lag. She had discontinued psychiatric medication in anticipation of getting pregnant. Miss Norman's own mother had been admitted to a psychiatric hospital shortly after the birth of her first child. This episode was not talked about in the family, and there were few other details. She had no other family history of note. Until just before delivery of her child, Miss Norman had been a highly functional nurse in a renal unit. Her husband was the head of the sales team, and they lived in comfortable social circumstances. She had no history of illicit drug use, and prior to pregnancy, drank only 2 to 3 units of alcohol a week. On mental status examination, Miss Norman wandered around the room, seemingly unable to sit for more than a few moments. She was distractible and over-talkative and demonstrated flight of ideas, flitting from one subject to another. Her mood was labile. At times she appeared happily euphoric. At other times she was tearful and could become quickly irritable when she felt she was not being understood. It was clear that she had a number of delusional beliefs that she was unwilling to discuss with the examiner. She did insist that she had already killed her own child, which led to several minutes of tears, but she returned to an edgy euphoria within a few minutes. She denied an intent to harm herself or anyone else. She appeared inattentive with poor concentration, but would not participate in formal cognitive testing. Physical examination and lab tests, that's a spelling mistake, were within normal. So that about concludes the case for Miss Ursula. What do you think she has? What kind of diagnosis do you think she would deserve? And we will discuss the diagnosis according to the DSM-5 in the upcoming video. And please don't hesitate to share your answers, your suggestions, your discussions down in the comment section below. And I will see you very, very soon. Thank you, and bye-bye.